Moxibustion explains how gentle warmth restore fertility, balance, even helps breech baby turn naturally. You have probably heard of acupuncture, but have you heard of Moxibustion? It is ancient warming therapy that uses the herbal heat to restore balance, awaken fertility, and even support pregnancy when a baby is breech. At GinSen in London, we have been combining acupuncture and Moxibustion for over 25 years to help women strengthen their reproductive health naturally. So today, let's explore what Moxibustion really is, why warmth therapy so much in fertility, and how this gentle therapy is even used safely in late pregnancy if you are currently facing breech position. Part 1. What Moxibustion is. Moxibustion comes from leaves of mugwort, an aromatic herbal prized in Chinese medicine. For thousands of years, the dried leaves are grounded into soft fluff and shaped into moxa sticks. This is moxa, sticks to cones, which are then born to produce the deep, smooth, strength warmth. In clinic, we burn the moxa near the acupuncture point to gentle warm the meridians, stimulate the circulation, and encourage the smooth flow of qi and blood. There are two main methods. Direct Moxibustion, a tiny core of moxa, is placed on the skin or sometimes on the top of an acupuncture needle. Allow the heat to travel directly into point through meridian, transfer heat to activity qi energy, yang energy. In direct Moxibustion, a glowing moxa stick is held about an inch above the skin, gives steady warmth without contact. From a Western point of view, this warmth increases the local blood flow and relax muscles, and also this is help you move out toxic accumulation. From a Chinese medicine perspective, is awaken yang qi, expel the cold, and restore harmony between yin and yang, the foundation of reproductive health. Part 2. Why warmth matters in fertility. Intition, cold, and stagnation are two of the biggest barriers to conception. When cold settles in the lower abdomen, whether from exposure, stress, or long-term hormonal imbalance, it constricts vessels, slows down blood flow, and cools uterus. We call the cold in the womb a condition that can lead to painful period, delayed ovulation, or premature egg quality, implant difficult. Moxibustion gentle reverse that process by react yang qi and warm the channels around the uterus and ovaries. It restores the circulation and energy to reproductive organs. Even you have fallopian tube blocked, it can help. Women often describe feeling comfortable, radiating warmth, speed through the abdomen, and sign of qi and blood flow freely again to help your eggs release as well. This therapy is especially used for fatigue or low energy associated with yang deficiency, irregular circles, and sporting cold hand and feet, or menstrual pain easily by warmth. Moxa is not only for trying to conceive, it also supports hormone balance, digestion, and overall vitality. Part 3. How it works for breech presentation. Moxibustion has another factor used during late pregnancy, help a breech baby turn naturally. This best time to beginning this therapy is between 30 and 40 weeks of pregnancy, when the baby still have room to move. The uterus is most responsive to gentle stimulation. During these stages, we apply directly Moxibustion to a specific acupressure point called blood 6-7 Zi Yin, located at the outer corner of the pinnacle. This is a point belong to the blood meridian, which connect closely with kidney channel and garners the energy flow through the pelvic and the uterus. In practice, we warm each point for 15 minutes twice a day, used for several days, or sometimes 3 times a week, each time 30 minutes, under guidance of qualified practitioner or midwife. After Moxibustion, many mothers notice more frequent fertile movement, often in the evening when baby is relaxed at these stages, we recommend to combine the treatment with a specific supportive posture to assist the baby turn. If you like to learning the correct posture, simply reach out to our expert team. We will happy to guide you step by step. So in traditional Chinese medicine, blood meridian is most active in the afternoon between 3 and 5 p.m., a period when its qi and blood are at their peak. This is why this time window is considered most effective of Moxibustion in breech correction. At 2023, analysis of studies has shown modulated quality evidence that Moxibustion can help turn breech babies. Some hospitals, especially in the UK NHS, have even training the midwife or therapist in acupuncture, and Moxibustion offer it as a safety complementary option when performed correctly. Safety notes: Moxibustion is very safe when carried out by training a professional because it involved heat, correctly distance, and timing are essential to avoid burning. At GinSen, we use this one, which is use modern technology and used without smoke, so it's even powerful heat and effort, and always tailor the treatment according to your consultation, whether you need a warmth, movement, or relaxation. If you are curious whether Moxibustion could support your fertility, balance hormones, assist your pregnancy journey, book a personalized consultation with GinSen, available online or in our London clinics. Warmth can truly awaken your body's natural rhythm. I'm Dr. Lily, and thank you for watching. Remember, healing doesn't always begin with medicine or technology. Sometimes it starts with something as simple and powerful as ancient as warmth. Thank you.